City of Twin Falls is speaking out, sharing why they are not speaking about certain search and rescue efforts. It deals with suicide, and after the sheriff's office says they got complaints for not sharing the details about why they were out looking for a person. They say it's to prevent more people and from more situations like this doing the same thing. Hunter Funk reports.
A beautiful landmark, ridden with tragedy. The Twin Falls Bridge bringing in visitors from across the world, but leaving the community grappling with the public nature of suicides that happen there. Thursday, more than 100 people prayed and walked across the bridge, raising awareness about the resources for those going through challenges.
I think that we have a unique situation here in Twin Falls with the Perrine Bridge, where suicides are a little more public. Our community knows about them when one of them take place on the bridge. And so, we have community members that are wondering why media isn't posting about that.
Lori Stewart is with the Twin Falls Sheriff's Office and the Magic Valley Suicide Prevention Group. She says there's a reason they don't publicly talk about suicides when they happen.
You don't want to sensationalize a death by suicide. And there is definitely the factor of copycat or suicide contagion. And so the last thing that we want to do by bringing that specific death forward and talking about that specific death is creating that contagion.
According to the CDC, Idaho is among the top 10 for suicide rates, and Twin Falls sees higher rates compared to other areas. In 2022, Twin Falls had more than 25 deaths per 100,000 people, where Boise sits at 22 and Nampa 19. Stewart says there's a few factors to this.
We do have higher suicide rates than a lot of the counties in Twin Falls, and obviously Idaho has higher suicide rates than a lot of the nation. So we do believe that some of that is the rural issue and isolation. Some of it is, lack of resources.
But it's not just people who live in the area. The national appeal from the bridge has an impact. She says of the 4 deaths by suicide from the bridge this year, only 1 was a Twin Falls County resident. Still, there's been 17 suicides in the county so far, but she says a majority happened by other means, which is why she encourages people to keep things locked up so people don't have immediate access.
Suicide occurs usually in a time of crisis, and it happens very quickly. So if we can slow that time frame down, then we're going to be a little more successful in preventing those. So.
She says because the bridge is so public, if you see something, call 911. And don't go to social media to talk about it.
We actually had people in this last week find out about a loved one's death by suicide from a social media post. So I would just really be cautious and again, really think about if this were happening in your family, how would you want that portrayed? What would you want to see the community and the public and social media do?
Recently, a senior put up a sign with the suicide hotline by the visitor center in hopes to prevent things like this from happening. As for infrastructure, Stewart says people are working on it, but community involvement is the quickest way to get people the help they need.
My phrase these days is don't let the bad days win.
Now, we have a full list of resources on our website. Also, be aware the 988 number is not only for someone that's in suicidal or mental health crisis, but also for people trying to help another person or somebody that's lost someone to suicide.
And I know when these conversations and these stories come up, one of the most popular questions are, I'm not familiar with this stuff. I know I should be. What do I look out for in terms of someone I'm worried about?
Yeah, I think that's the biggest thing. Any changes in their behavior. If they go silent, if they're sleeping more, if they're withdrawing from social activities, talking about death, depression, those are all warning signs. Just give them the resources and be that comforting source to talk to.
And again, that phone number, 988, a wonderful resource. Again, you do not have to be in crisis to call it.